Good evening. My name's Bhavini Makwana. I'm the Campaigns and Projects Manager at the Thomas Pocklington Trust, and welcome to Eye Care and You webinar 29, which is all about how the eye care support pathway can empower you. Now, before I hand over to our speaker today, I just wanted to share a little bit of a background about the pathway and how some of you kind of fed into the pathway. A couple of years ago, we had meetings where you shared your experiences of attending eye clinic appointments and low vision clinics and shared exactly what was going right, what wasn't going so well. Um, and that fed into the launch of the pathway. Now, earlier this year, myself and a group of us formed a task and finish group with RNIB to develop the public facing pathway, which I was really proud to chair. Now, that came about because I didn't receive the support or any signposting to any services when I was diagnosed back in the late 90s. And actually, over the years, I found out I wasn't the only one. And what happened was actually very wrong. I should have been signposted to a variety of different services and signposted to different charities and support that could enable me to be independent, live confidently with my sight loss, especially a deteriorating eye conditions, which meant I was continuously adapting and losing my sight and learning how to cope. Everyone on that task and finish group actually had lived experience of sight loss. We spoke to carers, we spoke to partners, and we spoke to people who are living with sight loss. And in September of this year, the public facing pathway launched. Now, I won't tell you more about it because our speaker today, Jayshree Vasani, who's a strategic engagement manager at the RNIB, is here to tell us exactly that. What is the pathway? How can it empower you? What stages does it have? And if you feel that you have got the support you needed that needs to be in the pathway, then what can you do about it? So without further ado, I'd like to invite Jayshree Vasani.
Hey, Bhavini, thanks very much for that great introduction. I'm pleased to say that you were the chair of the Task and Finish group, and that in itself is testament to the work that you and other people, even on this call, I noticed there's a few people here who are part of the Task and Finish group, and it's a very important part of the eye care support pathway, to be fair. So let's start. So good evening, my name is Jayshree Vasani, Jay Vasani, and I work for the RNIB as a strategic engagement manager. Before that, I was an eye care liaison officer, which is an ECLO. Okay, so let's tell you about the eye care support pathway, and then we can move forward from there. So I wanted to just let you know how the eye care support pathway started. Okay, so 3 years ago, RNIB held an event with key organizations working in eye care, and one of the main areas of discussion was the aim of ensuring that in the future there would be no diagnosis of an eye condition without support. Okay, so at that event, speakers from across the sector talked about the following things: that the needs of patients need to be built into the design of the services, that unless something changes, nothing will change, and that there needs to be belief that change is possible, that nothing can be done without hope and confidence, and that we need to be determined, we need to be courageous, and we need to be bold with our asks. So we took that message away and recognized that we could play a role in bringing together organizations across the sector to work together to produce an eye care support pathway to enable better support for adults with eye care needs, and for that pathway to be consistently delivered across the UK. So more than 500 people with lived experience have been consulted, 50 professionals across the sector were engaged, and 30 of our leading eye bodies were represented. And the eye care support pathway, therefore, is firmly rooted in people's experience of living with eye care needs or working with and supporting people with eye care needs. Okay, so during the research and development of the pathway, we found the following things. Navigating the pathway is complex and confusing for patients. Support is not person-centered. There are no formal links to support services. Support that does exist isn't always consistently offered. Okay. Support that exists isn't consistently offered to all patients. There was inaccessible communications like letters that people couldn't read or text messages. That waiting can cause stress and worry, like waiting for appointments. And that at diagnosis, there is an emotional impact. So overall, we identified 109 potential problems that people with eye care needs and sight loss were experiencing. So that's a lot of pain points. And we also know that an area of support where there's been historically neglected is the emotional support with treatment and support for eye conditions, because it focuses on the physical impact of sight loss and changes in eye health. So there needs to be greater recognition of the emotional impact of changes in sight from the beginning of a person's initial appointment through to diagnosis and living with an eye condition, so that they can access the right support at the right time. What we often heard is that when people do get access to support and information, it can be transformational in how they deal with being able to cope with the diagnosis and the impact that has on their sight. So we had a patient who actually, was giving us some feedback during those groups, and she said, when I got to see an eye care liaison officer, it was like having a block of concrete came off me. I would also mention that the pathway is focused on adults with eye care needs, and it's guide dogs that would be taking care of the pathway for children, young people, and hopefully that'll be launched soon. So really, with the eye care support pathway, what's the ultimate ambition? What's the main aim that we want to do? So thinking about it, from the moment that someone realizes that something isn't quite right with their sight, through to diagnosis and being able to live confidently and independently with their condition, people have access to the information, support, and advice they need. Okay, so the screen, actually on the screen, there's a diagram of the eye care support pathway. Okay, and there's a title at the top which says eye care support pathway, and underneath the title, there's a subheading which says supporting you at every stage of the journey. Okay, underneath that, there's a graphic showing the 4 stages of the patient's individual journey, and we've blocked it into 4 stages. So stage 1 is having my initial diagnosis. So that's you maybe going to the optician and saying I've got a problem. They've had a look at it and they said, okay, you may need to go. It's not something we can sort out. We need to refer you to, let's say, the hospital. So stage 2 is having my diagnosis confirmed. That's you going to the hospital and them telling you, what's happened, what's going on with your eyes. Okay. Stage 3 is support after my diagnosis. If you've been told that you have a problem, let's say you have some diabetic problems, how do you move that forward? How do you look after that? How do you get support to manage that diabetes, if you like, for your eyes? And then stage 4 is living well with my condition. So what is it I need to do to make sure that my eyes are protected, that my eyes, I keep the vision I have, okay? So each of the stages are linked with a line, and in between each of those is a text saying waiting well, to highlight that there are often periods of waiting from one stage to the next, and people require support at these stages too. And at the center of the diagram, there's a depiction of a person to highlight that the pathway is patient-centered. And underneath that, if there's that person, there's 3 key support requirements. Okay, so that is understanding my eye care journey. So people should know what's going on, what's going to happen to them, and who is going to treat them and when. The second one is understanding my diagnosis, which is what condition do I have? How do I manage it? And what does it actually mean to me? And the third is how to access, critically, the practical and emotional support that they need on that journey. Okay. So in November last year, we published the eye care support pathway document, and that was aimed at professionals. And the report was endorsed by 23 different organizations. So the next slide has lots of different organizations on that slide, and that includes the Royal College of Ophthalmologists, the College of Optometrists, the Royal College of Nursing, and national and local charities, and it's a reflection of the work really that has come across the eye care sector and how we can work together to improve the outcomes of people with eye care needs. And I have to stress that this is the first time that all of these organisations across eye care have come together around a project like this. And it's the first time that the support of needs of people going through an eye care journey has been mapped out in this way. Okay, so we have a pathway now. So what are the next steps? How do we move forward? So we will be working to develop pathways, clinical pathways for specific eye conditions to make sure they reflect the specific needs with particular conditions. So if, for example, if you have a cataract, that's an eye condition that might need different support to somebody who, let's say, has retinitis pigmentosa. So this will be a groundbreaking piece of work, as many of us know that the NHS runs on clinical pathways, okay? But if we get the support that's needed and get that embedded into these, we will be in a totally different place. What we want it to do is become part of the norm, okay, of managing a patient. So it means that the excellent clinical care will be matched by excellent support for each and every patient, and we'll keep you all updated on how these pathways go. So I'd like to talk about the version of the pathway that we've developed as a booklet for people with eye care needs, and that's for their families, their friends, and themselves. You can download the booklet, okay, the pathway booklet, from the RNIB website. So if you Google eye care support pathway, it should take you to there. And what we've done really is created an invaluable resource, really, with input from people with sight loss, people with experience of eye care and its needs, and relevant family and friends and carers. And that's why, as Bhavini mentioned, we established a task and finish group, which was made up of people with lived experience of accessing eye care needs and with sight loss. So as one of the members of the group said, we are passing on our experience to other people. There are 250 people a day being registered blind. That's a lot of people over the year, but if this booklet can help one person, it's making a difference, isn't it? We hope that this resource will empower people with eye care needs to have all the information in one place so they know what's available and how to access the support that they need at each stage of their journey, eye care journey. So much of the support is already available, but people don't know about it. They find out about it by accident and often very late in the journey. And we know that the earlier you get the support, the better off you are in general in terms of your eye care needs. So people really do need to know what's coming next. They need to know where they can get the right support. They need to know that they've got the support they need and when they get it, and they need to know how to get that support. And more importantly, what's coming down the line, because people want to plan and people want to know what's going on later on. So ultimately, the guide aims to empower individuals to self-advocate and know how to get in touch with the right people and the right organizations that can help them manage their eye condition. And the key message is that of self-advocacy. The more you can advocate for yourself as a patient, the better the outcome. So the hope is that the impact will be providing people with the information and support they need to navigate their eye care journey with confidence from the outset. And I hope you'll recognise just how important this pathway is for millions of people across the UK with an eye care diagnosis, along with their family and their friends. So really, this initiative is more than just addressing eye health. It is about changing lives. It's about fostering independence and inspiring confidence. The more individuals can advocate, collaborate, connect, and communicate, the more we can change the system together. Implementation isn't just necessary, it's critical if we are to ensure that no one faces sight loss alone and that eye care becomes truly holistic, inclusive, and transformative. Thank you, Bhavini. Hope that makes sense to you.
Yeah, thank you, Jayshree. And like you mentioned, if anyone is interested in reading the pathway document, you can download, and we will send a link with the webinar recording link to the actual RNIB page that contains the eye care support pathway. Before we go on to Q&A, I'd just like to remind everyone that our next webinar will take place on Monday, the 9th of December, is our 30th webinar, and we'll be drawing them to a close for temporarily. So we've done 30 webinars next month, actually. So we'll be taking a bit of a break and assessing them, evaluating them. But I just want to highlight that our next webinar is on Monday the 9th, and we'll be discussing the eye condition macular degeneration. So Macular Society will be our guest speaker.